What started in Gloucester has reverberated throughout the entire country and changed the way in which police departments and others are thinking about addiction now as a disease.
Almost 400 individuals came through the program in the first year. Of eligible individuals, almost 95% of them were offered placement into either detoxification or treatment programs.
We've heard from some of the largest police departments in the country now getting ready to implement programs just like this.
One important factor of the Angel program is that it was open 24 hours a day. And so individuals, whatever moment they were motivated to seek treatment, they could come in and get care.
Police have known for decades that what they were doing was useless. Now they have a way to help people, and they're really excited to be involved.